Chairman, and to the ranking member. If I had to summarize this hearing in one word, it would be this: agreement. Neither Democrats nor Republicans support waste, fraud, or abuse, and we all must do more to stop it any way that we can. And at the same time, while we fight fraud, we cannot do it at the expense of patient care. The real challenge before this committee is ensuring that the systems within our jurisdiction actually work for the people who need it in real time, when patients need care, not after the fact. So as we move forward on this front, hopefully in a bipartisan manner, we must ensure that any policy we put forth does not move us away from patient care and towards a more bureaucratic system, especially at the expense of seniors, including people like my own mother. Like many on this dais, I'm part of the sandwich generation, supporting college-age children while also helping to care for an aging parent who's enrolled in Medicare. Navigating Medicare on her behalf has made one thing clear: the challenge isn't just fraud. It's whether care is accessible, coordinated, and whether it's even there when it's needed. And when it's not, it's families who are the ones left to fill the gaps with their loved one. So, Ms. Martin, I want to ask, what safeguards are in place to ensure that efforts to prevent fraud do not delay or disrupt care for seniors who depend on it in a timely manner? And what reforms would both strengthen fraud prevention and improve care coordination so families are not left navigating this system on their own?
Thank you for the question. I think that Congresswoman Sanchez brought up her bill earlier, and that would be a good balanced approach to both protect program integrity and also support caregivers. It puts in new safeguards into the Medicare program. For example, it puts a temporary moratorium on new providers in the hospice program, but also puts into place special protection, so if there is an access to care need, providers can be enrolled. In addition to that, it provides respite care for caregivers, which is very important, as you know, that sometimes the caregivers also need care.
Thank you. Ms. Yanni, your testimony highlights a deeply troubling reality. Many patients don't even realize that they've been victimized until long after the fraud has occurred. Your experience underscores a critical gap in our system. Victims often lack the resources, the guidance, and support that's needed to identify fraud and to take action. Given that, shouldn't we be investing more in victim assistance, not only to help individuals recognize when they are being defrauded, but also to ensure that they know where to turn for help once that's occurred?
Absolutely. And as Sheila mentioned earlier, the Senior Medicare Patrol was truly the thing that resolved my situation. I could not do that independently. And I am relatively capable and a decent advocate for myself, but I had no means except for what that provided. And I would never have known about it had it not just been for a Google accident. So thank you for mentioning that.
Thank you to all of our witnesses. This has been a very informative hearing, and it's an area where there is agreement. So I hope that we will work together in a bipartisan way, not to just talk about a problem, but to actually work to address it. With that, Mr. Chairman, I yield back.